When I kind of started in sales, I wanted to get into healthcare, and you couldn't really right out of college get into that. So everyone told me life insurance, payroll services, office equipment, things like that. So I went into office equipment. Blessing and a curse. My plan was to be there 6 months, and I was there 5 years. So I think the beauty of it was I worked my way up to a zone manager, but I learned how to um, I really learned how to hire, develop, and train people.
Mm,
But eventually, then I wanted to get back into my career. That's when I transitioned over to back into healthcare and got on with a company called Novartis. It's a large pharmaceutical company. I got into
yeah.
specialty, got into ophthalmology, and did everything there from a rep to managed care to management to OR rep, you name it. And towards the end there, we were building out the DSO space because your optometrist is your general dentist, and all your specialists, glaucoma, retina, all that is just like in dentistry, your perio, prosthodontist, oral surgery, all that. And then from there, I received a phone call about Johnson and Johnson was looking to enhance their dental division. Never really thought about getting into dentistry. But what they were looking to do was build out the DSO space. So I was on a team that we built out the DSO space for J&J, eventually worked my way into senior leadership. And then my original CEO at J&J, he left, went to Dentsply for 10, 15 years. And then he picked up the phone one day and called me and said he had just become the CEO of Solmedics. And they were looking to buy three more companies and merge four companies into one, and they have no presence in the DSO space. Do you want to join? Do I want to join the journey all over again? So I came over to Solmedics, spent about 2 years building out the DSO space, and then just about 6 months ago, so I was same thing that happened at J&J. I was tapped on the shoulder and put into senior leadership to kind of handle both the private practice side team and the DSO team. So that's what I'm currently doing right now. We play in an interesting space in dentistry. Um, it's probably the dirty secret of dentistry. Because you need dental water for every procedure it's done. And when he first called me, I didn't even know what he was talking about. I had been in dentistry for over 20 years, never thought about water. But
I didn't know
you,
it was a niche. I didn't know dental water was a niche in
it
itself.
is. I mean, you can't perform any procedure without water in dentistry.
Yeah.
So if you don't have water,
Yeah.
you can't perform a procedure. And
Yeah.
unfortunately, right now in the US, 70% of offices don't test, shock, or treat their water lines. They just hope what's coming in the building is good, and it's not. And that's why
Mm.
there's outbreaks, and we're starting to see laws passed. So we're the only organization that comprehensively handles water in, through, and out of a practice. So to really help with that end-to-end water solution, so the water enters the practice, and then travels through the practice, and then eventually travels through the patient, and then exits the practice. So we consult with groups to make sure that they're giving their patients the best experience they can. So Solmedics is primarily amalgam capture to keep the environment safe. Um,
Yeah.
uh, Dentistry is the number one pollutant of amalgam in the world. Then we also work on vacuum lines because that's the other portion. You have to have a appropriate running compressor and vacuum, or you can't see any patients either. So without a compressor and a vacuum and water, it doesn't matter if you have 1,000 people in the waiting room, you can't treat any of them. So
Yeah.
that's where we focus on the Solmetic side. Stericell is water treatment, water testing, water shocking to keep the practice safe. Uh, Dry Shield is isolation dentistry. So I'm not sure if you're familiar with isolation dentistry, but it's a device you insert in the mouth, and it kind of works on two arms of the business. One, if you have appropriate staff of dental assistants, which most people don't these days, but if you do, it's incredible because now you can really practice four-handed dentistry, and the dental assistant with this device doesn't have to worry about the suction, the patient in regards to the cheek, the tongue, the bite block, the patient. It really helps them speed up procedures. And then probably, the one thing that we learned out of coming out of COVID was prior to COVID, we thought that aerosols came out of the patient. Post-COVID, after all the studies, we've now realized 80% of the aerosols are coming out of the dental unit water lines. And with 70% of offices not testing, shocking, and treating their water, it now explains why team members, being the assistants, the hygienists, and the dentist, why dentistry has such a high rate of eye infection, ear infection, upper respiratory
Mm.
infection, nasal infection, because they're breathing in contaminated aerosols all day long at a very close rate. So this device also not only does it help with staffing shortages and expediting procedures, it also captures 96% of aerosols to help keep your team safe. And then we have a whole other arm of our business, which is socket preservation for implant dentistry, which sounds a little strange in the beginning when you talk about it. But the reason why is, if you're doing full-blown surgery, you should be using saline and other things to make sure you're keeping that patient safe. But there's a lot of things like pulpotomies and endo, extractions for implant dentistry, where unfortunately they're using the water that's in the operatory, which you're now opening up the body cavity to exposure and you're using contaminated water. So that's where a lot of people get sick or infected, or why implants fail, or why endo procedures don't work, because you're extracting teeth, you're doing pulpotomies with just unfortunately contaminated water. So we
Mm.
really work with them. One, we have a product that is a bone graft to really help with that. But two, we also focus on the water side to make sure we're keeping those patients safe and keeping those high ticket items, making sure they're successful. So that's a lot of what we do on a daily basis. And like I said, right now I lead a team of inside reps that, are following up with customers, an outside commercial team calling on private practices, and then also an outside DSO team that's calling in the DSO space.
And I was doing my research and I found that you guys also do a lot of regenerative solutions like bone grafting materials and membranes for
Yep.
surgeries and all.
Yep, that
That's
was the
another
last one I
brand?
was talking about. It's a company called Implant, and they own
Okay.
Oxygen Plug, they own OsteoFlex membranes. So that we do a lot of consulting. We used to fully own Spear Education. We're now a minority owner in Spear Education. So we also do funnel a lot of DSOs that don't have an appropriate training platform to be able to lean on Spear Education for that, to teach how to do, implant dentistry, socket preservation, those type of things for them. But yeah, we do a lot in the implant dentistry side of things when it comes to socket preservation and bone grafting.
Okay. So what has been the hardest sell for you in terms of convincing dentists to switch away from their tap waters and get Solmatex?
Well, I mean, I think, on the Solmetic side, it's pretty easy. We have about 95% market share because there is a federal law that they have to capture their amalgam.
Mm.
Water's probably going to move towards that, which we need it to. I have a lot of conversation with M&A advisors, and what they're asking me is, has a water outbreak happened? Because the two things M&A advisors are looking at when they purchase a practice is one, has there been a cyber attack? Fortunately for them, that's a federal thing. You have to report that. Nobody wants to report it, but they have to. But they know there's probably going to be a class action lawsuit at some point for leaking of data. So they want to know that. But then the other one is where we come into play is they want to know, has there been a water outbreak? And most water outbreaks are never reported. They never go to court. The lawyers are going to tell you settle as fast as you can. And what the average is, from what I hear from legal people I talk to, is about $80,000 per patient per incident. So it can add up pretty fast, but they don't. What they don't want is that word to get out. Same thing for us. We could easily go and promote that 70% of offices don't test, shock, and treat their water lines. The reason why we don't do that is, prior to COVID, 40% of the U.S. population didn't go to the dentistry. After COVID, it's now 60% of the US population doesn't go to the dentist.
Yeah.
Dentistry is a very profitable business, but you're also only working with about 40% of the population. Of the people that have insurance, which there is no such thing as dental insurance, there's nothing to insure. Every
Mm.
patient walking in is going to use it. That's not insurance. It's a coupon subsidy, but of that, half of them never even use it every year. So we don't want that number to rise from 60% to 70 to 80 to 90 because people are fearful of getting sick with contaminated water. And we don't want 50% of people not using their insurance to go to 60, 70, 80%. So we work with the groups trying to consult with them what is best. So from that standpoint, we're on the compliance side. We're on the opposite side of EBITDA. Obviously, revenue growth is what drives EBITDA. What we focus on is cost savings in the insurance side to protect that EBITDA. And obviously, if you can cut cost, that EBITDA revenue dollar is now stronger than it was before. So that's where we spend a lot of our time, but I think we both know it's a lot easier to sign the back of a check than the front of a check. So
Yeah.
some people, compliance isn't where they want to be, and so a lot of it is working with them of what is your gambling appetite. you're probably eventually going to get caught, but what is your gambling appetite for that? Everybody's different. Everyone's compliance poor program is going to be different. How much are you willing to spend? How much do you want to protect yourself?
Mm.
Everybody has a different take on that. And it's
Yeah.
not really our job to be the compliance police. Our job is to consult with them of this is what you should be doing. Now let's build a protocol that's going to work for you of what your gambling appetite or your expense appetite is willing to allow.
Yeah. And it's funny because a lot of times people don't realize that compliance is more like an investment, a protection investment. It's an insurance plan for your practice, right?
Yeah.
It's when they're hit with like all these suits that they realize that this was an expense that could have easily been avoided.
Yeah, the largest outbreak in water is the Anaheim case. It was about, I think it's up to about, they quit publishing it and talking about it. It's up to about 450 to 600 kids is the estimate that were
Oh.
infected by one DSO and primarily a couple of the offices. And what they found was that pulpotomies were performed, and a lot of these kids ended up getting sick. And we're not just talking sick, we're talking they lost jawbone, they lost teeth. They're on antibiotics that are used for like leprosy, that it's going to impact their life, of how long they're going to live and what their experience of life is going to be. And that
Mm,
case happened in 2015. It's still in the courts. And the reason why it's still in the courts is they now, with AI technology, have found out half of those pulpotomies should have never been performed. And it was
mm,
a Medicaid office or DSO. So now you have the federal government involved. So it turned from a water case very fast to a fraud case.
mm,
And that's why you don't want inspectors coming into your practice because if they don't find what
yeah.
they're looking for, they're going to find something else.
Yeah, and then it maligns the entire industry, right? Even if somebody is doing an honest job, they also get the bad word of mouth through it, and people just start losing their faith. They don't want to
Yep.
come in unless it's a life-threatening situation. And it gets harder and harder for the dentists who are actually out there doing their job in all honesty to convince people that, coming in for
Yep.
an hygiene appointment is not going to cost you an arm and a leg, but it can save you a lot of health issues in the future. So it's just devastating, and I hope that it all gets regulated much sooner rather than later.
Yeah, I mean, that's where one area I think dentistry doesn't realize how lucky they have it as they're being not as regulated as they are. But you're
Yeah,
correct. I mean, that plays into a large portion of why 60% of the U.S. population doesn't go to the dentist.
yeah,
But that's not a great thing for dentistry as a whole. So the more people we can get in, and we now realize everybody knows and is gaining more knowledge every day that it's not about the oral health, it's about overall health, and the mouth
yeah,
plays a big key into that. But yeah, I mean that's what we do a lot of consulting on that to help them realize what they should be doing.
yeah,
But should be doing and doing are two different things.
yeah. So, Steve, that brings me to a very interesting question. You mentioned that you guys have like a 95% market share, right? What are some of the unmet challenges that you feel still need to be addressed?
Well, I mean, obviously that's where the other companies come into play. On Solmedics for amalgam capture, we have 95% market share. So, 95% of offices are using our system. And really it's because, there is, once again, when it comes to amalgam capture, the office is responsible from cradle to grave. And if someone doesn't recycle that appropriately or doesn't dispose of it or has a spill or anything like that, the office is responsible for that hazmat cleanup. So we're very good at what we do in that arena. But a lot of it now is how do we bring in isolation dentistry to help protect the teams? How do we get people to test, shock, and treat their water lines?
Mm,
So it's not just about the evacuation of water. We're now focused on what's happening on the front end, the quality of water coming into your practice. How are you treating that water? What's happening when that water crosses over to the patient? So we've had been very strong, and we are strong at the evacuation side of things with vacuum line cleaners and amalgam capture. How do we get to the front end to make the back end a lot easier?
awesome. Awesome. I'll just give you like a couple more questions. I saw that you have over 2 decades of experience as a DSO and dental industry partner, and you'll be launching like new products and new experiences. What do you think is the key behind introducing an innovation, especially in a market that is so saturated, bombarded with new ideas, new products, new services every day? What do you think sets apart something that is uniquely innovative from everything else that's coming up? How do you keep up with the competition?
Well, I think a lot of it is you got to show the value of what you're doing and what those products perform. But more importantly, you have to find the problems that offices have or the customer in front of you has versus selling a product. No one wants to buy a product, but they love to buy things. But they
Yeah.
only like to buy things if it solves a problem they have with the solution you have. So that's probably, one aspect of starting there. And then I think a lot of it comes down to, um, having good products and be able to demonstrate how those products can help that practice, like you talked about the insurance side of things, whatever it is. So
Yeah.
I think a lot of it's having good products, but also being able to back up those products and making their life easier by implementing those products.
Absolutely. And just the last question, you mentioned about putting together a lot of high performance teams, right? Because of the extent of your leadership experience. Tell me about the challenges. Tell me about what are the key things that should be kept in mind when you're hiring, when you're looking for talent to bring into your teams, when you're hiring, when you're trying to retain them. What is the key principle that keeps them together?
Well, I think for any leader, the most important thing you're ever going to do is hiring people. Most don't take it very seriously. They just figure a body's a body. For me, it's not as much about the background, the skills, and all that. It's about the attitude and what the makeup of that person is. And for me, to really build a high performing team, you also have to build a cohesive team.
Yeah.
So a lot of that is realizing that, my number one customer is my team. It's not the customers we service. Same thing in a dental practice. The offices that are great and the practices that are great and the DSOs that are great realize their number one customers are team. If they take care of their team will take care of the patients and the community that they serve. If they're only focused on the patients, well, the teams aren't going to be there very long. They
Yeah.
realize you don't have their back. So, it starts with that, but then it comes down to, are you developing and challenging your people? But if you're not building a cohesive team, which all starts with trust, if they can't trust you, they're probably going to go somewhere else to do something. There are people that don't fit, but I think a lot of it is, it all starts in the hiring process and the onboarding process. Same thing like with the last question you asked about, how do you differentiate yourself? It all comes down to implementation. If
Yeah.
you can help them implement and show them how to implement this into whatever they're doing or the change that they're making, um, then you're going to win because they don't really want to do it themselves. Everybody wants the easy street, the easy pill. They want somebody to
Yeah.
do it for them. So, the more you can coach and develop your people, the more you can coach and develop your customers and make their life easier. That's how you're successful and that's how you win.
Awesome. Okay. So, Steve, what's next for you? I mean, I know that you're coming to Smile Together next week. Tell me about what is the agenda, and what is the plan for the future?
The plan for the future is growth. I mean, we'll probably buy a couple more companies in the next couple of months. Filling out a full portfolio. So a lot of it's continuing to hopefully change the industry to realize that water is important, realize there are better ways of doing socket preservation and isolation dentistry. We will have other products coming to the portfolio to do that. But a lot of it's, like I said, it's building the teams, building confidence in them, building, cohesive, high-performing teams to perform. We're all in business to make money, but, at the end of the day, we're all walking each other home. So why not have a good time while you're doing that? So a lot of it's trying to find the right people that want to succeed, want to see dentistry get better, want to see change in dentistry. I mean, people shouldn't be going to the dental practice with contaminated water and getting sick. And I think a lot of
Yeah.
people, unfortunately, just don't realize that. They think they got the flu, a cold, or something like that from the grocery store, the movie theater. But if they just left the dental practice, it probably came from there. Or
Mm.
there's a potential that it did. So, we want to stop that just so the world's healthier. And that's what we're really there to do is protect the practice, protect the patients, and protect the environment.
Awesome, Steve. Thank you so much. And I think it was so insightful and so informational. Guys, this was Steve Craig from Solmatex, and I would love to thank him for coming on board and sharing his insights with us.